Sorry, we had an interruption in the other YouTube, so we are switching over to this. So, if you've been following us from the other YouTube, you will discover I was actually talking about back pain, solution for back pain. So, basically, what we'll be talking about here today is solution for back pain. I know a lot of persons have issues with back pain. Okay, so in this video, we are going to be talking about how you can actually get solution if you're having back pain. So we're talking about how you can get solution and what the solution is actually. So I'm Oliver Victory, your kidney health coach, and one of the things that informed me to do what I'm doing, because some people will be surprised seeing me do this thing. Okay, like what is actually fueling this young man to always come online and talk about things that affects our health. So years back, when I got to know about issues, when I got to know about the life expectancy of Nigerians, I felt very very bad about it. To be frank, to be sincere, so I felt so bad about this condition. So I was like, Nigerians, we can actually our life expectancy can actually improve. I think then it was about 55 years of age or 54 years of age. I was like, whereas in other countries, okay, you can actually get someone living up to 77. Life expectancy was up to 77 years, while in Nigeria it was 50 something. So I felt like I think we're not staying in the hospital and nursing patients in the hospital is actually not enough. That we actually need to come out and share the good news to everyone. We need to come out and tell people that this is actually what they need to do in order to be healthy. So I began saying this. I began this preaching from kidney health. Okay, so that is why I'm popularly known as kidney health coach. And I even address myself. Like when was I? You heard me say, "My name is Honorable Victory, a kidney health coach." So why did I even start with kidney health coaching? I started with kidney health coaching because at the moment, at that point, I was working in the hospital and I was working in the dialysis unit. So in that dialysis unit, I saw a lot of kidney patients coming. So one of the things that caused condition, this I developed kidney failure. So they were, most of the times when they come, they'll be asking me what actually my condition, what actually caused this condition. So I'll be left with explanation to explain to them what actually led to. Instead of us to sit down and wait in the hospital for these patients to come, why not we go out and meet them? So we now went out to meet them, and the rest is history. So another thing I also observed is that when I came on, I started from offline. I came online and started doing this kidney health talk. I discovered that a lot of people are online misleading Nigerians, and it's also affecting our life expectancy. Because one of the things that happens to us is that when you're sick, the way you look for information, like the way you look for health, actually affects the outcome of that particular illness. Imagine if you're having malaria and you're taking paracetamol. I think that's a common example. You're having malaria and you're taking paracetamol. You discover that before you know it, that malaria that you would have just used a little drug to correct can actually kill the person. So I discovered that most of the time, this is actually what is causing the lives of Nigerians, especially. So that's why I have to come online to now start propagating the good news of what actually needs to be done. And in today's discussion, which happens to be the first I'll be doing from this my glorious office, this office that will be reaching the world from here. So as you can see, branded. So I'm very very excited today about this presentation. So the first topic we will now be talking about is solution for back pain. Okay, now we are talking about the solution for back pain. What actually made me to talk about back pain? Okay, like if you know me very well, if you be following me online, it's because that I always talk about lower back pain. So now, why am I now generalizing back pain? The reason why I'm generalizing back pain and talking about um, back pain is because I recently I ran an ad. I did an ad, and a lady came in. I was like, everybody's always talking about lower back pain. What of upper back pain? So today, in today's conversation, we're going to be including upper back pain, middle back pain, and lower back pain. I'll be discussing that in details. So now let's start. What is back pain? Okay, pain is actually a discomfort. Let's start with pain. Pain is actually a discomfort. So, and it exists where the person who is having the pain says it exists. So, most of the time we have what we call a pain scale. I think pain scale is between 1 to 10. So, we usually tell people in a scale of 1 to 10, when you come to the hospital, describe the pain you're having. So, now we're talking about back. We have a lot, most things have front and back. So, in the human body, you're looking at the posterior trunk. Okay, for those who are into, so you'll be able to understand me. Posterior trunk, that is at the back, like behind the human being. So you'll be looking at any pain from the neck down to the waist. Okay, so that is what we'll be looking at for. So, and as you're following me, we're going to be, in the next few minutes, we'll be done and we'll be out of here. I don't intend to keep us here. So, I want to thank everybody for following us. I want to thank Farida for your comments. I'm saying it, and I thank everybody that have actually joined so far. So now, what am I saying in essence? We're talking about back pain. I said any pain at the back between the neck to the waist. So now we have different type of pain. Like I've said earlier, we have severe, we have mild pain, we have moderate pain, and we have severe back pain. Then we have pain at different regions of the body. So now you have pain at the back. So when you have pain at the back, apart from every other thing that you may have in mind, this pain may be due to, okay, sorry, it may be due to, it may be caused, okay, now let's look at the causes. It may be caused by overuse. Okay, most of us, we carry heavy loads. Okay, we put on heavy loads, carry heavy loads, either on our shoulder or our head. So if the business you do, or the kind of activities you do on daily basis actually involve you lifting heavy things, you may actually develop back pain. Okay, so and another thing is that if you sit down for a very long time, that's why I'm sitting down now. If you sit down for a very long time, you are also going to develop back pain in the long run. I have an aunt, okay, she's actually she was a tailor. So at some point she retired when her children grew up and all the rest of them. She retired and she stopped working. So by then she stopped doing the tailoring job. One of the days I came to greet her, and she was complaining so much about pain at the back. So by the time we finished talking to her, we discovered that the pain she was having was at her lumbar region, and this pain was due to the kind of job she did when she was young. So like now, what I'm saying in essence that when you stress yourself during your young age, there's every likelihood that you will have certain amount of pain either during your active years or during your resting years. So you may have issues like that. So that is why it is actually very, very important if you work in an office or you work in a place that requires you to sit for a very long time to attend to people or to sign documents. It's actually very, very necessary. Also, very, very important for you to stand up at intervals and move around. Okay, so it's actually very helpful. Then, if you are always carrying something, at some point you need to rest your head. If you can get something, like you can get another means of conveying your loads or conveying your goods, please do. Because most of the time, this thing that we do, they report back and they hit back at us. And the money we are trying to save, will lose it. Okay? So now we've talked about that. We've talked about prolonged sitting. Then another thing that actually causes back pain is prolonged lying down. A lot of us love lying down so much. Okay? You lie down to press your phone, you wake up. Some of us even lie down to eat. Some of us, I don't know, we have this particular love for our bed. You keep lying down every time. I want to tell you that if you keep doing this, you will also be predisposing yourself to developing this lower back pain we are talking about. I don't know if you're getting what I'm saying. Now, I've talked about lifting off heavy things. Even those guys that used to go to the gym and lift up and do heavy lifting, you guys are also prone to having this back pain issue. I have a friend, my secondary school friend, he's a weightlifter. So recently, because I talk about back pain, he reached out to me. I was like, oh, like, look at he's having so and so back pain. I was like, guy, do this, do this. And by the time he finished, he was fine. So, like, if you're watching this video, wherever you're watching from, and you actually need me to advise you on any particular health issue, or you need me to advise based on the experiences you're having back pain, you can actually, I'll be dropping a link, or you can contact me on WhatsApp. Drop me a link here where you can actually use to actually reach me on WhatsApp, so we can actually talk about what best solution for you that you can actually use to handle your situation. So now we talked about the way sleep. Now we talked about everything. Now we said we talked about prolonged lying down, then sleeping in a wrong mattress or in a wrong bed or in a wrong position. So by the time you're not lying down very well, you're sleeping. By the time you wake up, you're going to have pain. Okay, I've seen a lot of people that came to me because of back pain. I advise them to change their bed. By the time they changed their bed, the back pain was gone. Okay, some people, I advise them to do one or two things, not even something very rigorous. By the time they had a change in that, they became fine. So, you now that is complaining of lower back pain, that lower back pain may not even be due to kidney issue. Because you've gone to scan and the scan is saying that there's nothing there. And you're still worried, but this pain is there. And it's called something that whenever you take pain relief, it goes off. True of us. But you've gone for a scan and they're telling you there's nothing there. I want to tell you that all lower back pain may not be due to kidney related issue. It may be due to it may be a pointer that you need to change your sleeping position. It may also be a pointer that you need to change your bed. Are you not getting the solution gradually for back pain? Okay, so if you've gotten that, let's go to the next point, wearing poorly fitting pads. Wearing what actually is the cause of the back pain you're having. So I tell people a little investigation can actually save your life. You can actually do a little investigation and it will be all that you need. Most of us are very, very scared of doing investigations. Okay, like we feel that investigation will reveal a lot of things about us and that knowing those things can actually cause us to start dying. But I want to tell you that that's not true. By the time you know what is actually wrong with you, it gives you an edge when it comes to treating the issue that is at hand. So, what am I saying in essence? If you're having back pain, try as much as possible to know what the cause is. You can actually go to the diagnostic center and request for an abdominal scan. So if this pain you're having is related to any internal organ, it will actually show. You can actually go for x-rays. Okay, after going for x-ray, you know what the cause is. So knowing the cause of a particular ailment makes treatment easier. It makes treatment it makes everything go. Even your doctor, the person handling you, will be happy with the treatment progress. Because there's no, like if you're handling a patient, if you're handling a troublesome patient, it's actually going to tell so much on you as a doctor or as a health practitioner. But you're treating someone and you're seeing response, it gives you joy. So it's actually very important for you to go to investigation and see what actually the problem is. So by the time you note the problem and know what it is, treating it becomes very important. Okay, now listen. If the pain you're having is due to gallbladder stone, it's very important for you to note the level at which this gallbladder stone is. Okay, what is the size of the gallbladder stone? Is it multiple? Okay, so certain level of gallbladder stone, certain size of gallbladder stone can be treated without surgery. Then there is a point it will get to. What you're going to need is surgery. And by the time you know that this is going to take surgery, it's going to be operated upon, what you need to do is start making preparations. And that if you go over the internet, you'll discover people will give you promises. They will tell you that every gallbladder, in fact, that they've treated it before. Okay, and they will start doing things that you can't even hold hand scientifically. So you know what the cause is actually and know what to do about it. So now we've talked about it, that the truth is that if it's actually if you're having issues, kidney related, um, liver related, gallbladder stone, fatty liver, whatever, you have a specific diet that you're supposed to be eating. Okay, so in subsequent classes that we'll be doing live on YouTube, we'll be talking about those things that you as a person need to start eating in order to have what? A healthy kidney, a healthy system. Like if you're having liver pains, what are you supposed to be eating? Okay, I'm not going to hide anything. I'm going to say it the way it is in this place. So now, if you're having this pain and it's related to the heart, you have to find out what actually is the problem with my heart. Are you having CCF? Are you having myocardial infarction? Whatever it is. So you just know what it is and make sure you treat it. If it is something that requires you to meet a specialist who is a cardiologist or who is a doctor that specializes on the heart, please do. Most of the times we look at money. The truth is that by the time you look at money, you naturally mix it. Okay, because life can't be equated with money. Gather all the money in the world, they cannot save life. They cannot. I'm telling you the truth. Life is actually very precious. Okay, so now you look at the kidneys. I don't want to talk so much about kidney because I've I've spent more than 90% of my time out there talking about, even here online, talking about kidney and kidney stone and kidney related issues. But before this video ends, I want to say something, and I want to say it because of those who have kidney cysts. Because kidney cysts can give you this terrible back pain that you feel like the whole world is falling apart. Okay, like if you've not had terrible kidney stone pain or pain related to kidney, you may not really be able to imagine how that pain is. Personally, I've not had it, but my biological dad, he had kidney stone. Okay, if you've been part of my class, you you'll be familiar with the story. Okay, so he had kidney stone. I saw him shed tears, and it was one of the things that made me to pick particular interest on kidney stone. So I actually helped him to pass kidney stone. So, and I've also helped a lot of people after that to pass kidney stone. So what am I saying? What message am I trying to convey? I'm trying to pass this message that kidney stone pain is very, very terrible. That you will not really be able to imagine it until you have it. So now, cystic pain due to cysts affecting the kidney cysts, is also as very painful as kidney stones. So now, what is the solution for you who is having kidney cysts? A lot of people come to my inbox and they ask me what is the solution for kidney cysts, what's the drug for kidney cysts. I used to tell them, if the cysts do not disturb you, don't disturb the cyst. Okay? If the cyst is not giving you issue, don't give it any issue. So work on the cyst, remove the cyst if you're having unbearable pain, if the pain is no longer bearable for you. But if it's something I can overlook it. Maintain your healthy diet, maintain healthy life. Stop going about the internet looking for medications for kidney cysts. Many people, because they're looking for medication for kidney cysts, they've lost their kidney entirely. So follow your doctor's instruction. Go back to your doctor. Go back to the hospital where you have been attended to. Go back to your healthcare provider and follow their simple instruction. Take your medication. If it is polycystic, watch it. Like go for regular checkup, maybe once in 3 months, once in 6 months, or as the case may be, depending on the level. Make sure you track the progress. That is if it is polycystic. Okay, so by the time it gets to a level that you can no longer take it as a person, it's becoming so enlarged that it's even showing through the stomach, you can actually go for removal. So then, if it is due to ovarian cyst, ovarian issues affect that has to do with the ovaries, because when someone is having ovarian cyst, inflammation of the ovaries, the fallopian tubes, it can actually cause back pain. So by the time you've noted that this is already what the cause is, please look for solution. If possible, meet a doctor who is a specialist in that field. It is actually going to help you to do what? To hasten the healing process, to hasten your treatment. But by the time you start looking for maybe alternative, by the time it gets to where you're going to handle the situation, you discover that it has become too late. But it's not going to be too late for you because you're going to be making a frantic decision, and you will be on the know of what you can actually do to be able to handle the situation. Then the last but not the least is infection. So the infection can actually cause someone to have lower back pain. When you have infection around the female reproductive organ or the male reproductive organ, you can actually have pain around that area. So when you note the cause, please. But I usually advise people. One of the investigations I tell people to do when they come to me for example, like do abdominal scan and do urine culture. Then, if possible, you can do liver function test and kidney function test. So this gives us a better view of what. That's the truth. Most of us, we don't know the difference between physiotherapy and massage. Okay, they are both to the going for meeting your physio and discussing about the back pain is actually very important. It's also very important for you to have, if it is a spine related issue you're having, like lumbar spondylosis, the best person to handle it is an orthopedic doctor. So meet the orthopedic doctor and discuss about this treatment. At some point, what you need may go beyond drugs. It may be a gadget that you wear on your waist that will help cushion it. Okay. At some point, it may be just simple physio, maybe phototherapy. You discover that the muscle spasm will go away. A lot of people have muscle spasm. They take a lot of drugs, it's not working. Go for physiotherapy, phototherapy. Sorry, a simple phototherapy can actually help you. So it is. How do you now? What are the steps you need to take? One, acknowledge that you have pain. Two, note the spots you're having the pain. Three, visit your doctor and discuss about the pain you're having. Four, go for the necessary investigation. Five, meet a specialist who handles the condition that you're being faced with. So if it's orthopedic condition, meet an orthopedic doctor who provides solution for that. Like I said, a simple phototherapy could actually tell you, could actually do the magic. A little massage could actually solve it. So, but stepping out of your comfort, kidney health is increased. Okay, so like last before I came live to this program. I was reading an article about the life expectancy of Nigeria for 2024. I saw that our life expectancy have actually grown from where it used to be 55. So March today, or Ivory Coast March today. Please, I want us to be very, very careful. If check your BP period around till